Hi, Andy.
Hi, Victoria.
We have Scott Shannon, who is an integrative psychiatrist whom you have known for a very long time.
I knew him as a medical student here at the University of Arizona and have followed his career with great interest.
Yeah, and he's really been a leader in integrative psychiatry and always compliments you for your mentorship.
And psychedelic therapy as well. I'm looking forward to hearing from him.
Well, let's get him on.
Okay.
Dr. Scott Shannon is a pioneer in the field of integrative psychiatry. He founded the Wholeness Center, an integrative mental health center, and served as the site principal investigator for the phase 3 trial of MDMA-assisted psychotherapy for PTSD. He published the first integrative psychiatry textbooks for both adults and children, as well as 2 books for parents, including Parenting the Whole Child. Scott has been a mentor to numerous physicians who believe in a more holistic approach to enhancing mental health and well-being. Welcome, Scott.
Well, thanks, Victoria. So happy to be here. It's an important conversation and happy to have it with both of you.
Wonderful. I would really love to have a dual conversation. One is, what has caused this crisis in mental health in young people? And 2, maybe more importantly, what can we do to alter it?
Well, it's been brewing for a while. Ever since I've entered the field, we've seen declining rates of mental health indicators. And we've seen this sort of multifactorial, sort of perfect storm almost kind of thing, where we've seen declining sleep, declining exercise, declining outside time, poor nutrition, less time with parents, an increasingly stressed adult population. And then in the last 10 years, really, this onset of smartphones and social media, which has really escalated all these trends to an unbelievable degree. And this all reached crisis proportions before COVID. Mm-hmm. So got to be clear about that.
Yeah, I have seen many experts point to the last point, not all the earlier factors, but the smartphones and social media as the evils that have really harmed our children. And curious whether that was just, from your perspective, the tip of the iceberg or something more fundamental.
I do think there's some fundamental things going on. And one of them is that I think our science and our society has become so denuded of spirituality and depth. And I'm just fascinated by how we've just lost sort of a spiritual sense of our existence and given that over to things. And it's becoming increasingly, I think, desiccated, empty desert out there. Not for you, those of you in Tucson, but a desert in other ways. Yeah, so I think it's a lot of things, but I think at its core, it's a spiritual issue.
And Scott, I assume you share my concern about the incredible overuse of psychiatric medication in children and adolescents. I think we have no idea what the effects are on the developing brain, alone or in combination.
Oh, I wholeheartedly agree. I just want to take a minute out to thank you, Andy, for your sort of mentorship and inspiration for me in my career, because I've tracked along with many of the things that you inspired me with, integrative mental health and psychedelics both. So thank you.
Yep.
And all my career, I think I've been an ambivalent prescriber. And so it allowed me to kind of keep a little bit of a jaded eye to this thing that most psychiatrists lose sight of. But like you, I'm very concerned because we just don't have the data that it's safe. And I think, like in the case of ADHD, we're now medicating probably over 10% of our pediatric population. And I think we're going to see increasingly that once we get away from this ideal that the chemical imbalance theory actually works for treating people, I think we're going to really see the detriment and sort of flotsam and jetsam that this has created for kids. Huge issues, I think.
So for a moment, be the czar of mental health for our society, the United States. What would you do differently? What would you do in families, in schools, in communities, if you were a policymaker? Like, how do we get to a much, much better place in terms of how we care for our kids?
Well, I think we have to regulate social media, and I think we should probably make 16 the age that kids can sign on to social media. I think we can instruct and educate parents about the need to keep kids off smartphones until the age of 13. I think we need to build more family. We need to build more community. I think we need to emphasize outside time, nature, exercise. One of the biggest issues with smartphones is the opportunity cost for kids to develop relationships, to be outside, to have free play. And I think we have to empower schools to take some actions and really have phone-free schools. And it's not just encouraging kids to turn them off, but actually taking them away from the 9 to 4 or 9 to 3 kind of block when they're in school. I think we need to probably get a little more strident about kids' nutrition, whether it's in schools or the labeling we have. I think there's a lot of things we could do, but ultimately in our society, most of it falls to parents. So I think we have to educate parents, inspire parents to take action, and we can ask for legislators to take action, but that seems to be a difficult task these days.
Well, good advice.
Are you aware of any communities or schools that are taking this step? I did hear about a school in Europe which did a kind of social experiment. They restricted use of cell phone in one of three ways. One was that the kids could have it at school, but it had to be turned off. The second was that they were collected at the door of the school, essentially. And the third was they had to leave them at home. I'm guessing that both of you can predict which one created the most distress in the kids.
Oh my God. Yeah, it's things like that we need to realize that it's like we require a license to drive a car, and we should have some regulation. And because it's clear when you look at the data that around 2012, in a synchronized way across the world, pediatric mental health accelerated its deterioration. And we can look at 20% cell phone penetration in 2012, but by 2016, it was almost 80%. And so that is the piece that really changed the trajectory. So I think we need to get more assertive, both as parents, school administrators, and even legislators just taking on this issue.
One of the things I think is interesting is there appears to be a bit of a different impact on girls and boys.
Oh, yes.
Do you want to talk about that?
Yeah, it's really clear this has affected girls much more because in that sort of critical social learning, cultural indoctrination era from like 10 to 14, girls are much more focused on communion and connecting to a community. And for boys, it's about building agency and action. And so boys are drawn to video games that are action-oriented, win-lose, sports, kind of has that metaphor. But that's been much less detrimental because girls, what happens on social media, they get bullied, they get into comparison, they get obsessive about how their social standing is impacted. And girls have the ability to devastate one another with comments on social media. Oh my God, talk about mean girls. It's a thing.
And so on some level, the boys are actually still playing together, even if they're using a device.
Yeah, and they're often playing together remotely. So there is a cost to what's interesting is one-on-one friend time has cratered during this same 10-year period. Whereas 50% of kids used to be with each other after school, it's now like 20 or 25%. So that's fallen off. And so the relational component here is really critical for both boys and girls.
One of the former guests on our program is someone I know you know well, Dr. Bonnie Kaplan, and she really focuses on the importance of micronutrients for brain health. And I'm interested in knowing your experience with supplementing micronutrients in kids.
I think this is an area where these interventions win hands down compared to psychiatric medication. I stopped seeing people routinely last summer, but in the 20-some years before that, I found that working with broad spectrum micronutrients was just a game changer for me in dealing with pediatric mood disorders, particularly bipolar disorder, when it's just head and shoulders above toxic things like lithium and Depakote. So yeah, I think the world of these agents, I try to teach and train about them as much as I can. They're so much less toxic. And I think we now have 40 peer-reviewed studies supporting their use not only in mood disorders, but in ADHD, in other areas where they can be a support for people and help them to feel more well and alive as opposed to medicated and dulled.
We've been hearing a lot about the dangers of ultra-processed foods on health, and certainly kids are great consumers of these. And I wonder what the impact of that is on mental, emotional health.
It's got to be profound. And certainly we're seeing just the rates of type 2 diabetes and blood sugar issues becoming very critical for kids. And they're now predicting that within 50 years, maybe over a third of Americans will have diabetes, maybe approaching 50%. And that starts in the pediatric when we've seen weight gain in kids, obesity. We used to have the least obese state in the country, and we're now the same place that Mississippi was 20 years ago. It's horrific. And it's because kids aren't moving, they're sitting still, and they're eating the wrong kind of foods, like ultra-processed foods. So yeah, I have grave concerns about that.
Scott, I think you were the first physician that I ever heard present on the research for psychedelic medicines. And at that time, you were mostly talking about ketamine, which, of course, isn't a true psychedelic, as Andy likes to remind us, but it was what was legal and available. And I know you've also been a leader in medical cannabis, and you were a PI, a primary investigator in the MAPS MDMA trial. How do you see these, I would say, revolutionary medicines being integrated into integrative mental health? And will they have a role in kids?
I think they will have a role in kids. In fact, now that MDMA is about to have approval from the FDA, then we'll have mandated pediatric trials. So that's going to begin. But backing up a bit, I think these are a pivotal moment not only in mental health, but for our society at large. And one of the things I've been thinking about a lot is how we've moved so far from an understanding of our reality that's relational based or makes room for spirit and human experience. And I think that the pivot and what we see, this is interesting with psychedelics, is it's a contagion. This is one of the few things that Republicans and Democrats agree on right now. It's really fascinating, but we're getting bills across the aisle, legislative changes. It's now legalized in Colorado and Oregon, and other states will soon follow. But I think it's a draw inside. There's some spiritual hunger in our country and our society, and not just in mental health care, not in healthcare, but much more broadly. And I think psychedelics, as they shifted consciousness in the 60s, I think they're going to do it in a broader, more comprehensive way. We learned a lot of lessons from all those experiences in the 1960s, and hopefully we were paying attention. But I think it's pivotal. And I think because we're moving from a suppressive model of the psyche, where we try to reduce symptoms by managing misery and sedating people, basically, to an evocative model of the psyche, where we're trying to honor the healing power. And I think this is really going to be, psychedelics are going to move us from a very conventional allopathic model of pathology of the self to a model that's just very progressive, much more integrative, holistic, that makes room for the inner healer. So I think it's a beautiful moment of transition, and I'm so happy to be a part of it.
I couldn't agree with you more. One of the questions that frequently comes up is about the age appropriateness of using psychedelics and cannabis. The question is, are these dangerous for the developing brain? What advice would you give to parents, to kids? There are very powerful cannabis preparations that are now, you can buy them in convenience stores. So I assume that these are easily available to young people. Now, what advice would you have about young people experimenting with these?
Yeah, we're seeing vaping, tar, waxes, dabs that are getting over 50% THC content. And what we have is pretty clear data that this increases the risk for psychosis and likely decreases a lot of developmental tasks for people in mid to late adolescence and early adulthood. I've actually never been sort of a pro-cannabis guy. I've been a cannabidiol, a CBD guy, hemp-based. I think that's wonderful. So my feeling is it's recreational, and like I learned from my mentor, it's all about the relationship with the substance that you have. And so there are some people, teenagers, that can have a decent relationship with cannabis that's not abusive, but many can't. And so I have real caution there. I think the difference with other psychedelics is that they're used occasionally and they seem to be more anti-addictive, whereas cannabis can clearly have an addictive pattern that teens. I worked at a residential program in Boulder for a while for young adults, kind of failure to launch territory. And one of the biggest things we saw was these late teens who got into smoking a lot of cannabis and then lost all drive and motivation. Smart kids, capable, a lot of parental resources, but they ended up sitting in their parents' basement playing video games. And one of the key things is, how do we get them off cannabis? And what cannabis does to the frontal lobes, we've seen on our QEEG scans, is it really increases frontal alpha and just puts the clutch in. And so they spin and they don't have the ability to engage in the world. And so they end up in their parents' basement. Not everyone, obviously, but this can be an issue. So I share your concerns about some of the high potency cannabis agents.
I realize the cultural context is very different, but Andy, I believe that I've heard you talk about in some of the indigenous societies, children are exposed to psychedelics at a pretty young age.
Well, particularly it's used in adolescent coming of age rituals and under the supervision of shamans who are very experienced and are good guides. And it seems to be quite stable usage.
Yeah, my sense is that I see a role for them, and I think if it's managed very well and thoughtfully, think about the exposure someone has using a psychedelic 2 or 3 times, maybe just once at mid to late adolescence, versus everyday use of psychiatric medications. I don't even think there's a close comparison to risk. I think it's orders of magnitude different. Because with psychiatric medications, you're constantly putting it in the brain and forcing the brain to make changes. And a good portion of people that do that can't get off the medications. We now have millions of people in the US who are locked on antidepressants because they can't tolerate the withdrawal symptoms. So I think psychedelics pose less risk, but I think it's a little bit of a challenging territory to think about how we move down that age spectrum. We do ketamine treatments, ketamine-assisted psychotherapy for some teenagers, and have found that it can be helpful, mostly as a way to help them engage in therapy and open them up to the therapeutic process. But I think society's not quite ready for that milestone yet, but we're coming. And I think we're going to have the opportunity, I think, to work with MAPS, Lykos in the phase 4 trials with pediatric. It'll be adolescent 12 to 18 use of MDMA.
And do you have less MDMA concerns because it isn't a true psychedelic?
I think all these agents, and I'd have to differ a little bit with Andy on this.
Okay.
I think all of these agents, what they share in common is the ability to change consciousness and the flow of information in the brain. And so we can have classic psychedelics like psilocybin, 5-methoxy-DMT, and we can have things like MDMA, which is an amphetamine compound, and we can have ketamine. They can all change the inner experience, even though they're not all classic psychedelics. So when I talk to people about it, I talk to them as catalysts, inner catalysts for change in perspective. I think ketamine, it's not as good as the other agents. I will readily admit that. It doesn't have durability. And what the classic psychedelics have is durability. And once someone has a profound experience, it seems to stick to their ribs and lasts.
Yeah, it's just so interesting. I would like you to say a little bit more about this distinction that you made earlier between what you call suppressive medication and evocative treatment, because I don't know, it seems to me that most people would choose door number 2.
Well, I think that we developed this aura of intimidation around the psyche, is that people can become psychotic, they can have hysterical reactions, they can cry. And the agents that we began to use in psychiatry 70, 80 years ago all had this ability to mute responsiveness. And so antidepressants muted people's ability to care, not only about their own depression, but also about relationships and other things in their life. And then we have the antipsychotics, which are obviously very dulling, very sedating. And they can effectively hide psychosis for a period of time. But all these agents require daily dosing to suppress these symptoms. And like with benzos, I mean, the same thing that we got into with narcotics, we can see with benzos is that they take away fear, but they also sensitize to fear. And people have great difficulty getting off benzos once they've been on it. So, and these are benzodiazepines like Valium, Xanax, Librium, pretty common out there. The challenge is, how do we move from an era where we've been fearful about the psyche, trying to suppress symptoms, and pretending that we don't have the ability to heal ourselves, to a model where we can embrace healing, trust in the psyche, and allow altered states to begin to shift the stuckedness that people, the biggest reason people come to see me is because they're stuck. And I think what psychedelics do better than any agent, and clearly the classic psychedelics do this best of all, is they shake up somebody's snow globe and give them an opportunity to change the patterns that they've been stuck in. It increases neuroplasticity, which is that brain's ability to change and learn. That's the gold that we want to mine when we're working with people in mental health.
How do you feel about some of these new non-pharmacological interventions like transcranial magnetic stimulation and the various forms of light therapy? What do you see as the potential of these?
I think they may have some big potential, but I see TMS and cranial direct stimulation and other things being, we could call them ECT light, if you will, but they're really an external something that we're doing to the brain. And I much would prefer a transformational process like we could have with psychedelics that really encourages the body's process to grow and change. But I think what we see with TMS and other things, and clearly I think there may be a role for it, because certainly psychedelics are not yet broadly accepted. They're not reimbursable. And TMS is probably less, I'm sure it is, less traumatic and invasive than ECT. But I think it still has that model of we're doing something to people and they're a passive recipient. Whereas in the psychedelic framework, we're encouraging people to have an active process of growth and transformation. Sometimes we can't get that, but I think if we can reach for that, I think that has to be our ideal.
It seems to me that some of the earlier things that you mentioned were absent in our society also unstick people. So like when people go on a wilderness experience and connect deeply to nature, they get unstuck from their life in one way. When they become very spiritually connected, they often get unstuck from their life in another way. I'm just curious what else you think besides psychedelics, which, as you said, are not so easy for most people to access at this time, fix the brain.
I have this whole category of things I call spiritual catalysts. So one of them is like world pilgrimage, world travel. Spend a month in India and not come back a changed human being. But we can have religious conversion, St. Paul on the road to Damascus kind of thing. We can have meditation. We can have sometimes a disaster, for all of its negative implications, creates massive change. And then we have these sort of life events that are pivotal, like the birth of a child, the death of a parent, divorce. These can be stimulations that really shake someone's snow globe up. Psychedelics can do it. Near-death experiences, although I'm loath to prescribe them because about 25 to 50% of people die, But yeah, there's this whole category of spiritual catalysts, and it's really fascinating. It takes me back to the work of Jerome Frank and how he looked at all these different things that could support healing.
Andy, can you add to that list?
No, that's a pretty good list. I like it. I think travel for me has been a big one. Just experiencing other cultures, being around different kinds of people, that has tremendous potential.
Yeah, I agree.
You said disaster. I have to say, in my clinical practice, where I've taken care of a lot of women with breast cancer diagnosis often completely unsticks someone.
Yeah, they've done surveys and said some significant portion of women would not go back and do it over because they felt that it was such a catalyst for change and personal evolution. So, yeah, sometimes we need to get hit over the head with a 2x4. I listened to you at Psychedelic Science last year, and I loved what you were saying about 5-methoxy, why you think it can be the future for psychedelic medicine.
Well, 5-methoxy-dimethyltryptamine as was the main constituent of toad venom, our toad here in the Sonoran Desert. And when inhaled, vaporized and inhaled, it produces a very intense altered state that's quite short lasting, maybe 5 minutes with some period of come down. It's not visual. It's an experience of total ego dissolution. I think it has tremendous potential for preparing people for dying, for really discovering that you are not your body, that you're not your mind. It's a great catalyst to transformation. So I think I just see great potential for it. Many people have experimented with NN-dimethyltryptamine. That's intensely visual. You see cartoons and entities. I mean, that's all fun, but I think 5-methoxy is much more serious.
We're in the middle of a study right now with Beckley with 5-methoxy for treatment-resistant depression. Yeah, we've treated a couple people so far. Impressive. We hope to roll it out at our clinic under Proposition 122.
I will be very interested to hear the results of that. I just think it has both the duration of action and the quality of effect. I just see much greater usefulness for it than some of these much longer acting psychedelics.
Well, I'm curious now, Andy, what you're interested in. What's the rock you're looking under right now?
Well, I really want to see materialistic psychiatry go away. I think the whole biomedical model of mental illness is just wrong. I think we need a whole different way of thinking about the brain and the mind. And it's not all biochemistry, and not all emotional disorders are rooted in brain biochemical dysfunction and therefore only treatable with medication. I really want to see that disappear. I was absolutely horrified when I began to see antipsychotics recommended to make your SSRI work better. I mean, unbelievable. These are very powerful drugs for major mental illness. And on television, they're advertising, your antidepressant not working, ask your doctor to prescribe, an antipsychotic. Unbelievable.
I know, and it's sad. And the 80% of the antipsychotics that are used in children are used for non-psychotic indications. It's just for behavioral control.
Right.
And they sedate the kids. I mean, they do work, but at what cost?
Mm-hmm.
You may be interested to know that one of your early pieces of advice that I listened to was always consider history and philosophy when you're trying to understand what you're doing. And you'll be interested to know that I'm rolling out a program on metaphysics, that we need to go back to understanding metaphysics to really properly discuss and understand mental states and where psychedelic experiences take people, because we're now finding that a psychedelic experience can shift your metaphysical perspective from a materialistic perspective to a panpsychist perspective or something else. And so I think we need a language to talk about it. And I'm really hopeful that this inward arc that we're beginning with psychedelics can take us to honoring the depth of thought and understanding that comes with metaphysics.
I'm so excited to hear that you're doing that, Scott. And it seems to me that you continue to be a pioneer. And I know you've influenced the career of so many psychiatrists, many of whom are in despair, really, about the way in which they practice medicine in our country.
And, I see that too. And what I see is that the ability to do psychedelic medicine, where you sit with someone and honor their psychic process and honor their inner healer, has been transformative. And a lot of people can really move away from that place of despair when they start working with this different model that honors people's ability to heal. And we get away from that medication suppressive model, because I think it's in many ways toxic for the providers as well as the patients. And it really is deadening. There is a sort of a vacuum that happens with it that many people burn out with, frankly.
Yeah. I want to honor the work that you have done and the contributions that you have made to integrative medicine, to integrative psychiatry, and just to the lives of so many people. Thank you.
It's my pleasure. And I do still feel very passionate about all this. And I joke that although I'm not getting younger, I still feel as passionate as I did probably close to 50 years ago when I met you, Andy. So
good. Keep it up. Keep it up.
I'm keeping it going. So we're trying to innovate with new ways of assessing brain function through QEEGs, brain mapping, and having that help us determine treatment direction and ideally to direct us towards which psychedelics people are most responsive to, because I don't want us to get in the place 10 years from now where we're trying to pick between 5-methoxy-DMT, psilocybin, ketamine, and MDMA just based on a hunch. I don't think that's good science. I think we can do better than that. And right now, psychiatry is so driven by personal opinion and observation that it would be nice to have some more science to guide us as we try to help people find true healing.
Well, that is a very positive way, I think, to close this conversation, which has just been so rich. And we're just so appreciative of you. Thank you.
Yes, thank you.
My pleasure.